Hi, my name is Mary Jane. I'm 51 years old, and it has taken me 51 years to be diagnosed with systemic mastocytosis. It has been a very long journey from the age of 4 to my age of 55 now. My initial symptoms were GI symptoms, migraines, and bone pain. When I was really young, around between 4 and 6, I was stung by a bee, broke out into hives, and ended up with anaphylaxis and ended up having to go to the emergency room. That's where that journey for the systemic mastocytosis started. It went from that to going from different doctors because of different types of allergies, to foods, different allergies to medications. So as each year of my life went, it would be a different food, a different type of medication. Migraines were starting to get stronger. The bone pain was starting to become something that was a problem. It was hard to go through school and trying to plan for the future when I was feeling so bad. A lot of symptoms of nausea, of vomiting, diarrhea, a lot of GI issues, stomach pain. So it was going from doctor to doctor, clinic to clinic, hospital to hospital, different university hospitals, just trying to figure out what the different diagnoses would be. It started with migraine diagnosis, with an endometriosis diagnosis, with ulcer diagnosis, diagnosed with celiac disease, the bone pain. They contributed that to just like some type of arthritis, but they weren't sure. Different type, the hives were, it was allergies. There were different types of allergies. They just kept telling me, just take antihistamines for the allergies. During this time period, a lot of the doctors were dismissing a lot of what I was complaining about, the different allergies to the different foods, the different allergies to the different medications. They just kept dismissing it as anxiety. Anytime I had a very strong reaction or anaphylaxis, it would always be pointed towards I was having very bad panic attack or anxiety and bringing on the symptoms. So it was very discouraging to feel so sick and to have anaphylaxis or to have reactions or to have hives and it be dismissed as just purely anxiety or a panic attack. It has impacted my daily life because I'm not able to work anymore. I had to go on disability because even environmental factors were affecting me. Anytime somebody would come in with perfume, I would break out into hives. Or if there was a strong odor of cleaning materials that they would use to clean the offices, it would cause a lot of hives or a bad reaction. So I had to go on disability due to the fact that I couldn't be around environmental odors, due to the fact that I had severe migraine and severe bone pain from the mastocytosis. So I ended up losing that part of my life, feeling like I was a productive member of society. It affected my friendships because I wasn't able to spend time with a lot of my friends because I was in bed sick all the time, or I couldn't be around them because they were either wearing perfume or we were in an area that would cause a reaction. So that part of my life also was lost due to the fact that I couldn't be around so many people. And after a while, a lot of those friendships just fell to the side because they couldn't depend on me to be there for them. My family has been helpful, and I'm grateful for that because they've seen everything that I've gone through. It's been very hard for them though, because my husband has pretty much has had to take over most of the household work, making dinner, going to the grocery store. My children have had to take me to doctor's appointments because I can't drive that much anymore. So it has caused a lot of anxiety and a little bit of depression because I feel like I'm not useful anymore to my family. Just taking up space, basically. So that plays into the depression and into that I can't do very much anymore. As far as the anxiety goes, a lot of my anxiety comes from the fact that when is my next reaction going to happen? When you have anaphylaxis and somebody gives you epinephrine, sometimes you lose all control of your bodily functions, and that can be humiliating. It could be very hard. It's scary. Your heart goes so fast. You feel like you might not live through this. You lose control of your urinary tract, of your bowels, and you can start vomiting, and the nausea sets in. The shaking. It is a very, very hard experience to go through when you have anaphylaxis. And there's so many different stages of it. Also, it could be to, where your throat isn't actually closing up, but other bodily functions are not working. Once the epinephrine is in your system, and you have to let it go through your system, there's so many things going through your mind. You feel like your body's being shut down. And it is something that, unless you experience it, it's very scary. So the anxiety hits when somebody says, oh, try this new medication, or we have this for your migraines. And the first thing that goes through your mind is, am I going to end up in the emergency room because of the anaphylaxis? Am I going to be in an ambulance? Am I going to be able to live through this experience? I would say to somebody that's going through this is to keep fighting and keep pushing, keep asking questions, research as much as you possibly can. Get a hold of the Mastocytosis Society and have them send you information. Talk to others that are going through the same thing that you are. There are many people out there that are going through the same thing you are, and you need to advocate for yourself, research for yourself, and have your family advocate for you also, or your partners and your friends. Explain to them what you're going through. Don't stay silent. Make sure you talk about what's wrong. Make sure you let people know. Make sure you talk to your doctors in a courteous way so that they can listen to you and understand what you're feeling and what you're going through. Education is so important when you have a rare disease. Advocating for yourself is so important. Pushing for help is so important. Don't be silent about what you're going through. Be vocal about everything that you feel. Be vocal about the medications that you're allergic to. Be vocal when you're in the emergency room, if possible, or your partner, family member, friend needs to be vocal to let them know what's wrong and what needs to be done.